My name is Dr. Ibrahim Wada. I am the Chief Executive of the Nissa Medical Group, which comprises hospitals, diagnostic centers, pharmaceuticals, even a training institution, and special laboratories like genetics. I'm very pleased to be at this point because it all started in a very basic manner. It started with me as a specialist out of the country, gynecologist and expert in infertility and IVF, with a mission home to say, look, I must try and add value to Nigeria at a difficult time in the country's history. This was 1994, but I eventually established the Nisa Premier Hospital from a very small beginning, and I'm so grateful to God for where she is now. Positioned in Jabi here, also in Garki, a public-private partnership that we've run with the FCT administration for 14 years or more, transforming that project from a dead hospital, more or less, to a vibrant community that's helping a lot of the people in these cities. Nisa is also in Kaduna. We just want to share this story with you of the major developments, because I see it as either Nigerian magic or Nigerian dream, in a sense that if you have your heart to the mission, you can accomplish more here than almost anywhere in the world. So where did we start? How did we get here? Where are we? It's a story, it's an international story. And I believe in the Nigerian dream. And I believe the time has come for more people to come on board so that we can push it to the cloud and have medical institutions here that are equal to what you get in some of the best parts of the globe, the advanced countries. It starts small, but we can grow as more and more people get interested. So if you ask me what's the focus of the Nissa Medical Group, I think it's a total package for health and well-being. And I insist that our lives are as important as any other person's life. I also insist that what a group can do is far better than what an individual can do. And that's how I coined the motto that Nigeria can and Africa can. We have the biggest economy in Africa. We are the most populous nation in Africa. A time has come for us to be the leaders of Africa and not even think differently. So this effort, this sacrifice that we've made to get a small project to where it is one that should live as an example to the younger generation of what can be done, what can be achieved in this country. As a hospital, our focus is mainly on women and children at the very beginning, but we've expanded far beyond that with the onset of the National Health Insurance, and many health insurances coming up. It's a growth area. Families want to go to one destination instead of one going here, the other one going there. So we've expanded in line with that. And I can tell you that what is happening now towards universal health coverage, where the National Assembly has kindly enacted a law saying every Nigerian must be covered in health. That means that just like they gave out communication, telecommunications, and we can communicate like any other being in this world now, liberalizing the health space by approving or accepting universal health insurance, so every born child doesn't have to have money in the pocket to go seek help. It's a revolution as far as my field is concerned, and it beholds greater things for the country. So Nissa needs to be positioned not only to take advantage of that, but to make its own contributions so that all manner of people, whether rich, whether poor, whether middle class, can access this project. So, and I think it's a fundamental part of our being. We don't just want to be for one group, only the rich, but we must treat the rich in our country. We cannot forever think, oh, you have money, just fly out. No. But you are poor, you must be treated. You are middle, you must be treated. You are rich. So Nissa is designing quality care for the spectrum of the population, and that's what excites me. It's not about its focus on a special group. What about us? What about the rest of us? So the mission that started in Cambridge 1994 with a heart to come and help home, and the preservation of life by the Almighty God, and the help through the difficult times and the challenges that has brought us to this point where we can look at the world and say, we've done something, come join us, come help us, come make Nigeria a destination for health. Come make Nigeria a country to be proud of, let's put it that way, because unhealthy people are not happy people. Health is your wealth in all aspects, whether it's emotional or physical or whatever you define health as. So we are in this space with total faith that the future looks bright for all of us. People ask me, if this has all been achieved in just over 20 years, where are you going to be in 20 years' time? And I said, honestly speaking, I see the Nissa Medical Group participating in the healthcare industry in Nigeria the way many of the bigger private establishments influence in Europe, in America, India and all that. I expect Nissa in many of the big cities in Nigeria, the state headquarters, catering for a group, a whole spectrum of people. I expect Nissa to veer into West Africa at least, because we are the big country we are, then we must help them too, because they can't muster the quality of personnel or financing. So I see that happening. I want to hopefully live to see it, don't get me wrong, but God owns life and our wellness. So gradually, if my faith in Nigeria is anything to go by, why are we not in South Africa? And why are we not in Egypt and the rest of the world? Why not? Who's stopping us but ourselves? So let Nissa be an example of the next generation of Nigerian medical effort.